ഇന്നത്തെ വീഡിയോയിൽ OBGയിൽ നിന്നുള്ള കുറച്ച് ഇമ്പോർട്ടൻറ്റ് പോയിൻറ്റ്സ് ആണ് പറയുന്നത്. ഓവുലേഷൻ മെത്തേഡ് ഓഫ് ഫാമിലി പ്ലാനിങ് ഈസ് നോൺ ആസ് കലണ്ടർ മെത്തേഡ്. Presence of human chorionic gonadotropin in the urine 6 to 12 weeks. The client is on magnesium sulfate therapy for severe preeclampsia. The first sign of excessive blood magnesium level is disappearance of knee-jerk reflex. The patellar reflex, also called the knee reflex or knee jerk, is a stretch reflex which tests the L2, L3 and L4 segment of the spinal cord. In the type 4 placenta previa, the placenta is located centrally over the internal cervical os. The diagnostic test used to evaluate the fertility is in the post-coital test. A neonate is delivered at 29-week gestation and weight 1600 gram. Based on the weight and gestation age, this neonate would be classified into preterm. ലോ ബർത്ത് വെയ്റ്റ് ബേബി ആണെങ്കിൽ 2500 ഗ്രാമിൽ താഴെയും വെരി ലോ ബർത്ത് വെയ്റ്റ് ബേബി ആണെങ്കിൽ 1500 ഗ്രാമിൽ താഴെയും എക്സ്ട്രീംലി ലോ ബർത്ത് വെയ്റ്റ് ബേബി ആണെങ്കിൽ 1000 ഗ്രാമിൽ താഴെയായിരിക്കും ഉണ്ടായിരിക്കുന്നത്. ടേം പ്രിമച്ചർ ബേബീസ് എന്ന് പറയുമ്പം 37 വീക്സിൽ താഴെയും പോസ്റ്റ് ടൈം എന്ന് പറയുമ്പോൾ 42 വീക്സിന് മുകളിലോട്ടുള്ള ബേബീസ്. The obstetrical conjugate measures 11 cm. The uterus rises out the pelvis and become an abdominal organ at about 12th week of pregnancy. The purplish discoloration of the vaginal mucosa in pregnancy is known as Chadwick sign. Braxton Hicks contractions start 8th week of gestation. The normal cardiopulmonary symptom experienced by the most pregnant women is shortness of breath on exertion. In pregnancy, cardiac output increases about 5 to 7 liters. In Erb's palsy, there is damage to the brachial plexus involving 7th and 8th cranial nerve. Quickening is felt by mother during the 15 to 22 weeks. Infants whose mothers have rubella in the first trimester are frequently born with cardiac abnormalities. Clear vesicle on the face, scalp and perineum caused by retention of sweat in the sweat gland is known as milia. Colostrum is formed at the 16th week of pregnancy. Pregnancy-induced hypertension usually occurs after the 28th week. Increased salivation is termed as talism. Progesterone is normally secreted in the large quantities by corpus luteum. The name given to endometrium during pregnancy is decidua. The amniotic fluid appears normal if it is clear, colorless, containing little white specks. A newborn has asymmetric gluteal fold. The nurse suspects a dislocated hip. From 18th week after conception, the fetus is covered with white creamy substance is called vernix caseosa. Last second known as apnea, 20 seconds. Bladder irritability begins at 6 to 12 week. Artificial rupture of fetal membrane is called amniotomy. The maneuver requires the midwife to identify the posterior shoulder on vaginal examination is Rubin's maneuver. The feed given to the baby in the place of breastfeed is known as supplementary feed. Fungal infection of the mouth and throat in neonate is thrush. A condition in which placenta remains morbidly adherent, placenta acereta. The most common preterm complication, respiratory distress. One of the medication given to women in labor which cause respiratory depression of the newborn is meperidine. The operative procedure which would result in the surgical menopause would be bilateral salpingectomy. Bilateral salpingectomy. This is when both the fallopian tubes are removed. Severe preeclampsia is diagnosed when the blood pressure exceeds 170/110 mmHg. The uterus reaches at the level of sternum. 36 weeks. Within 3 minutes after birth, the normal heart rate of the infant may range between 120 to 160 beats per minute. Infant intestines are sterile at birth, therefore lacking the bacteria necessary for the synthesis of prothrombin, a major group of substance in the breast milk which is of special importance and cannot be reduced in any bottle formula is gamma globulin. After birth in a neonate, the ductus arteriosus become Ligmentum arteriosum. A client experienced painless vaginal bleeding during the last trimester. This may be caused by placenta previa. Bleeding following severe abruptive placenta is caused by hypofibrinogenemia. Postpartum hemorrhage rarely occurs as a complication of pregnancy-induced hypertension. Descent of the fetal head into the pelvis begins before the onset of labor. If a woman with an untreated chlamydial infection is allowed to deliver vaginally, the infant is in danger of being born with ophthalmic neonatum. An edematous swelling under the scalp of newborn is known as caput succedaneum. Discharge from the uterus during the puerpenum is known as Lochia. Lochia rubra, the first stage. Lochia is dark red in color. Lochia serosa is the second stage. Lochia is pink in color. Lochia alba is third stage. It is whitish yellow color. Thanks for watching.